Thank you very much, Mr. Speaker. The Minister of Health has become the Minister of No Answers. His statements have gone from meaningless to downright confusing. Today, he tells the Calgary Herald he doesn't see a lot of new things in our Wildrose health plan. To the Minister of Health, given that it's quite obvious your government doesn't have independent health ombudsman like the Wildrose, medical savings accounts and publicly disclosed wait times like the Wildrose, a kinship palliative care program and decentralized service like the Wildrose, how can you say, Mr. Minister, there is nothing new?
Are you planning to do all that?
If this has anything
well, Mr. Speaker, the short answer is because there isn't a heck of a lot anything new, other than some musings about privatization. They want public funding to follow patients. We already are doing activity-based funding models in continuing care. At least they're being looked at. They talked about hiring more frontline staff. I can tell you that our physician headcount grew by 23.1% just within the last few years. I could tell you that we're hiring 1,100 more new nurses, and I could go on with that, so that's not new. They call it a health ombudsman. Our Act calls it a health advocate. That's nothing new. They want to make
the honourable member.
Once a liberal.
Once a liberal, Gene, always a liberal. He gives us no answer. To the Minister, when you say there is nothing new in our Wildrose health plan, is it because your government has seen and ignored these proposals in the Mazankowski report, the Graydon report, the Kirby report, all of which is collecting dust on this minister's desk?
Here, here. The Honourable Minister. The Honourable Minister has the floor.
Mr. Speaker, I could hardly understand a word being said because the member himself was trying to shut down his own colleagues, and that's unfortunate. But I'm very proud to be a member of the PC caucus, and I've run 3 times as a PC member, and I have the full support of my constituents.
The Honourable Member.
Thank you, Mr. Speaker. Given the non-answer, I'll ask the Minister of Infrastructure, who may actually give a straight answer. In your press release, which I have here, which I'll table, on June 15th, you confirmed a 100-bed long-term care facility for my constituency, Fort McMurray, and I thank you, sir. Yesterday, the Minister of Health in this House contradicted you, bragging about only a 48-bed. To the Minister, can you clarify this confusion? Has the Minister of Health cut the number of beds in half, or is he still just simply confused?
Well, thank you very much, the honourable member. And I do want to say to you that it is 100 spaces in Fort McMurray. Mr. Speaker, this government has invested $13.8 million in Fort McMurray, ensuring that we do have 100 beds, which include long-term care beds and affordable supportive beds. Mr. Speaker, the process now is in the RFP, and we have it down to 3 consultants, and we hope that consultant will be chosen by